Hi. I know that this is going to be a little bit strange for us to be teaching in this format. I know we're accustomed to interacting in the classroom a lot. And I'm sure some of you are already looking and wondering, like, didn't Dan just have a beard last week? And I did. Um, Shaved it off. It's a normal thing that I do in the springtime anyway, but it's kind of one of those precautionary measures. It's good to not necessarily have so much facial hair right now, in case you would have to wear some kind of mask taking care of somebody else, or be in a situation where you would need to have a mask on. As I had mentioned in class, facial hair kind of prevents those masks from working as well. So this is just kind of a preventative measure, not because I am worried about anything in particular, but just making a wise choice. I'm sure a lot of you are wondering what's going on. You're back home, or you're still in Rolla in a dorm where you're not quite sure what's going on. Maybe you've gone back home. Maybe you actually are still living here in Rolla, an apartment. Maybe you're living down in Fort Leonard Wood, or you're down in Springfield. There's a lot of things that are going on, a lot of people, different places. You're a distance student. You've been participating in class. There's a lot of folks that are going to be watching this video because I'm teaching 4 different classes this semester. One on fundamentals of environmental engineering, one on science diplomacy, one on public health in engineering, and one on environmental design. And all 4 classes I'm transitioning to online, and I just thought I would kind of explain what I meant by this announcement of what we're going to do the next couple of weeks. So of course this next week is actually class time. The following week is technically spring break, and you don't need to participate or do anything in classes during spring break, but I wanted to open up some optional space. I've been talking to a lot of colleagues. There's a lot going on around campus. How are people going to be able to teach? And a lot of folks are really struggling because they're trying to take what they've always done. Right? I give a lecture, I write on a chalkboard, and the students copy my notes. And they're trying to switch that into something that's online. And that's a real struggle because this, of course, is nowhere near as good as watching somebody in a classroom if you're going to try to learn that way. And so I certainly admire and very much appreciate my colleagues that are trying the best they can to take their normal classroom teaching and move it to something that's online. That's a tremendous struggle. But I'm stepping back a little bit further, and I'm sure you're not surprised that my approach to this opportunity for moving online is going to be a little bit different than some of the other classes you're seeing. First of all, we're going to still do the material that's on the syllabus. So all 4 classes will still complete out the material that's on the syllabus. We'll do a little bit of sliding back of some of the deadlines. We will slide things about a week back. You'll notice if you're in most of these classes, there's actually some buffer time the last 2 to 3 weeks of the semester. That was a time that I was going to be doing some traveling, and we have some opportunity for still having some interaction. And so all of that's going to still occur, but there's going to be a couple of minor changes to it. All right. So first of all, number 1, the reason why I have a required versus optional policy is because I'm trying to help teacher professionalism. And required means here's the deadline, you got to meet it by this date, and if you don't, you fail the class. I'm suspending that right now. All right, and the reason why I'm suspending that is because we can still be professional and not have to have that kind of artificial professionalism, which makes tremendous sense when we're not under stress, because that adds some stress, and that's a useful thing, but we all have plenty of stress in our life right now, so we don't need extra stress from worrying about failing a class because I didn't get something required on time. I'd still like you to get your work done, right? So that hasn't changed, but number 1, you're not going to fail because you missed some required assignment in some format or by some kind of deadline. So that is now suspended through the end of the semester. I'd still like to get your work done on time. I'd still like you to follow the schedule, but just reduce your stress, all right? So kind of take a deep breath. I can no longer fail because I didn't turn in an assignment on time, all right? So that's taken care of. Number 2, the next couple of weeks, both this week of class as well as next week of spring break, let's spend some time still interacting with each other, and let's move that from the classroom to the discussion board. We've already used the discussion board in class at the beginning of class to learn about each other. We've used it kind of throughout class for some different things. We're just going to rely on the discussion board a lot the next couple of weeks, because what I'm going to do is give you an additional 10 possible points towards your final grade. So every day I'm going to be posting a discussion board. I'm going to do kind of a quick video that goes along with it. I'm going to have some discussion board materials on there. What I'm asking for you to do is just get in the habit on a daily basis, Monday, Tuesday, Wednesday, Thursday, Friday. And then next week, Monday, Tuesday, Wednesday, Thursday, Friday. Hop on the discussion board, watch the quick video, offer some comments of what you would respond to the situation, and then wait a little while, log on later in the day, and offer some views on what your colleagues have said. Now, a lot of this is going on in social media space. A lot of this is going on in discussions at the coffee house or chats with friends. I want to use the discussion board to be a safe space for us to be able to have some discussions. And the reason why I want to have these discussions is because we're environmental health engineers. We use the garbage can lid to stop the plague. We use hand washing and inspections of kitchens to stop typhoid. We use the draining of areas that have standing water to prevent malaria. We use drinking and sewage treatment systems to make sure people don't get excess amounts of diarrhea. That's what we do. So, from the beginning of class, you've heard me say things like, I'm a healthcare provider, but I'm not the kind of healthcare provider that takes care of one patient at one time. I save lives. I save lives millions at a time. And this situation that we're seeing right now unfold is just the most recent, most current, most significant kind of pressing societal problem. And we, as public health engineers, will work with the rest of the healthcare industry to come up with some good solutions. Now, fortunately, there's folks that are in the vaccine space that are working hard to come up with vaccines, which are a fantastically useful tool. There's folks that are in the public health space that are saying things like, let's practice social isolation. And this is all about this phrase called flattening the curve. The curve is when we will have a peak in people being sick from this coronavirus. And if that peak is really high and really intense all at one time, the danger is that the healthcare system that takes care of acute care, not us in public health, but the folks that are taking care of acute care, so the physicians and the nurses and the pharmacists in the hospital, if that system has too many patients at one time, it doesn't have the capacity to care for everybody at once. So flattening the curve is all about how do we shave off some of the worst patient load that we're expecting to come out in the next couple of months. Because right now we're saying to people like, hey, please don't gather in large venues. So, churches starting to close, schools starting to close, restaurants are saying, hey, let's not come into the restaurant. We'll deliver the food. We'll bring food to you. You can do carry out or take away, but you can't do eating in the restaurant. It's because we don't want people to be coughing on each other, right? We don't want one person to be able to infect 10 and then that person to infect 10 more. That's how infections spread. And so this idea of social isolation, it's not going to stop the infection, right? I mean, we're going to still have some problems. Now, best case scenario is that we do enough really significant measures right away that we actually do stop the infection. And so that's what we're hoping for. But even if that doesn't occur, even if the infection still spreads through the population, if we can flatten the curve, we've made things better for the acute healthcare system. And so flattening the curve is what public health professionals do. Encouraging people to maintain social isolation, canceling events, that's all part of what public health does. Now, the bad side of that is that the way we're doing it right now is not very cost effective. Closing down restaurants, closing down the NC2A tournament, closing down basketball, closing down churches, that's not a very cost effective way of flattening the curve. Garbage can lids, clean water, safe food, we figured out how to make those pretty cost effective. Vaccines, we figured out how to make those pretty cost effective. So right now we're using an emergency measure to flatten the curve, and it's super expensive. So what I'd like us to reflect on today is this idea of flattening the curve. What does it mean to think about flattening the curve? What are some of the things that we do individually, collectively? What are some of the things we've heard about in public health engineering and environmental engineering that flatten the curve? So your optional discussion board exercise today is to identify a couple of items where we as environmental health engineers flatten the curve. And as a think, pair, share type exercise, right? Before you get in there and start reading what everybody else has posted, take a minute and reflect yourself on what are some of the ways, and be creative here. I mean, obviously there's well, wouldn't it be nice if we washed hands? Yes, and that will help flatten the curve. But let's think about what we both know as well as what we might imagine. What are we doing? What can we do? What are some of the things that will help flatten the curve as public health engineers? All right, so now, whether we're talking about science diplomacy, or introduction to environmental engineering, or environmental design, or public health engineering, we're all working in the same space. So I'll be posting these videos that go with the discussion board. As a reminder, a couple of things. Number one, you cannot fail the class by not turning in a required assignment on time. So lower your anxiety. Number two, we are going to have updated syllabi that adjust, sliding everything back a little bit. So essentially this week is not really kind of like a class time. We'll slide everything back, and after spring break we'll kind of pick up the schedule and we'll move forward with things slid back just a little bit. If you've already done the work, awesome. Submit it, turn it in, get credit. If you're like anxious for something to work on, then pick up a whole letter grade in the next 2 weeks by participating in these discussion board exercises. So I'll be posting a little video like this every day. I'll have what I'm looking for actually posted in text. Watch the video, answer the text, comment in, do that first thinking, right? And then come back in and comment on somebody else's post. I'll be weighing in on the discussion activities. We'll all be weighing in, and here's the ground rules. Extend grace to your colleagues. There are going to be some people that will say, all the stuff we're doing is a waste of time and money. And you know what? That's a valid opinion. That's a totally valid opinion. There are going to be some people that are going to say, I can't even think about this. I'm so worried about an elderly person in my home. I'm so worried about a young person in my home that has diabetes. I'm so worried about what's going to happen to my grandma or what's going to happen to somebody in my family. And those folks are going to be perhaps more in an emotional space and not so much in a cognitive space. Remember, our learning is about our knowledge, our skills, and our attitudes. And so it's not important that we just focus on what we know. It's also important that we feel comfortable to share with each other about what we feel. And so when we're talking about how we're going to flatten the curve, it's totally valid for you to be sharing, like, here's some of the things we can do, and this is how it makes me feel. Or here's some of the things we can do, and this is why I think this is a bad choice, and this is a good choice. Right? So extend some grace to your colleagues. Listen, read, look at their post. Walk a mile in their shoes. Understand where they're coming from. And let's have some fun the next couple of weeks in the discussion board in an online format, sharing and learning together. Look for updated information on the syllabi coming out in the next couple of weeks. Relax and settle into your new routines. Focus on getting engaged in this discussion board. Routines are super helpful for maintaining mental health. So the best thing I can do as a teacher is to create the environment in which you can learn. The discussion board is going to be the environment we're going to learn in together. I look forward to working with you over the next couple of weeks and throughout the rest of the semester. Have a great day.